we talked about axial and appendicular? Appendicular are the side ones now. We talked about all the axial ones. Now we're going to come to the appendicular muscles. Okay, so appendicular muscles are responsible for several things. Stabilizing the pectoral and pelvic girdles. So stabilizing your shoulder joints and your hip joints. Moving the upper and lower limbs, moving your arms, moving your legs. Absorbing shock and jolts as you walk, run, or jump. And they aid in strengthening the joint area. Okay, they allow you to strengthen the joint so they don't damage. Shoulders, knees, elbows, etc., wrist joints. Okay, there's two major groups of appendicular muscles. There's the pectoral girdle and upper limbs, which is your shoulder and your arms, and the pelvic girdle and the lower limbs, which is your hip and your legs. Oh, wrong one. All right, so this is how they break up. Muscles of the pelvic girdle and lower limb. Okay, so the muscles that move the thigh. Okay, this is this one. They originate in the pelvic region, and they usually insert on the femur. Okay. Muscles that move the leg. They originate on the pelvis and the femur, and insert on the tibia and or fibula. Okay, just kind of logical common sense here where they have to attach to make things move, to move the bones. Then you got muscles that move the foot and the toes. They originate on the tibia and the fibula, okay, and insert into the tarsal bones or the metatarsal bones and or the phalanges of the foot, of the toes. Okay, intrinsic muscles of the foot. There's a difference between extrinsic and intrinsic. We're going to get into that in a little bit. But the extrinsic are your bigger, thicker muscles that extend longer, that uses for your force, okay? Your intrinsic muscles are the smaller muscles that run within the foot or within the hand, okay? Those allow your fine control movements, like writing or delicately sewing something when you're using your hands to do something, okay? So the intrinsic muscles of the foot originate on the tarsal and metatarsal bones and insert in the phalanges. They're your shorter muscles, right? Muscle on the pectoral girdle are same thing as on the legs, okay? Muscles originate on the axial skeleton and insert on the clavicle and the scapula. Allow you to move the shoulder joint. That's your pectoral girdle. Because remember, there's only 3 bones that make up the shoulder joint. What are they? 3 bones make up your pectoral girdle.
Clavicle.
Clavicle.
Scapula.
Scapula.
Humerus.
And humerus. Perfect. Those are the only 3 bones that make up your entire pectoral girdle, your shoulder joint. And muscles that move your arm. These muscles originate on the pectoral girdle, okay, and the thoracic cage, and insert on the humerus. Allow the arm to be moved up and down, side to side, as they pull on the humerus bone. Muscles that move the forearm and the hand, they originate on the pectoral girdle, okay, and the humerus, and insert on the radius, the ulna, and or the carpals of the back of the hand. Extrinsic muscles of the finger, hands and finger. Remember, we said extrinsic muscles are your power muscles, your long muscles, your ones that are going to grip something really hard. Okay? These muscles originate on the humerus, radius, and ulna, and insert into the metacarpals and the phalanges. And your intrinsic muscles, these are your delicate muscles, allow you to take notes, allow your fine control of your fingertips. Okay? And not a lot of strength, but a lot of fine pressure control. Those muscles, they perform your fine movements. Okay? They originate on the carpi and metacarpal bones, carpal and metacarpal bones, and insert on the phalanges. Right? That's a basic overview of what we'll be doing. Okay, we talked about action lines a little bit. I mentioned that. Action line is if you drew a line between 2 muscles, and how it's going to move when the muscle contracts is an action line. So flexion and extension. Remember the difference. Flexion is decreasing the angle between the 2 bones. So when your elbow flexes, you form a muscle. It allows this angle to decrease at the elbow. When you extend it, you increase the bones. So flexing decreases the angle between the 2 bones. Flexing increases the angle between the 2 bones. Adduction and abduction. Adduction is moving towards the midline. Okay? When you bring your, like say you have your arms out on your side, when you bring them down towards the middle, you're moving them closer to your midline. That's adduction. Abduction is bringing it away from the midline. Okay. Medial and lateral rotation. Medial means moving it towards the middle. Lateral means moving towards the outside. Okay, that's a rotation motion rather than a movement coming in. Okay, and you have action lines at your hip where the muscles can contract, and you can determine where they're going to go. And there's two types of muscles we usually deal with. There's spurt muscles and shunt muscles. Spurt muscles are your primary movers. That's what does the work. Your shunt muscles are muscles that contract to stabilize the joint. Because if all you're doing with that joint, say you're weightlifting and you're doing curls. Okay, as you're doing curls, you're flexing your biceps to move that weight up. Okay. Now, if there wasn't muscles on the sides of your elbows, that weight could flex side to side and damage your arms, right? So the shunt muscles are the ones on the side of the elbow that can keep it in line and strengthen it, so you don't damage it during constriction. So your spurt muscle is your primary movers, your main muscle. Okay, the shunt muscle would that stabilize it and help prevent damage to the joint that's moving. They help keep it from going sideways and awry. Okay, so it's more of a stabilizing effect than a rotation effect for your shunt muscles. So the direction of the applied force is called your action line. That's the direction the force is. When that muscle contracts, like I said, it's going to move one direction. How that moves is your action line. Okay, these movements are the associated joint depends on the relationship between the action line and the anatomical structures of the joint. So if you know the axis, you know the muscles involved, you know the bones, you can tell when that muscle strength, what bones are going to move. Okay? And that's an action line. Okay, so here's different action lines. This is the acromion of the scapula. This is your clavicle. Okay, and this is the humerus right here. Those are the three bones that make up the shoulder joint, or the pectoral girdle. Okay, you can see that this is your deltoid muscle right here, and it's called it because it's in the shape of a deltoid, like a river tributary. That's why it's called a deltoid. It's in the shape of a deltoid. When the action line contracts, when this contracts, it pulls this direction. Okay, so what's the humerus going to do? Look at the picture. Look at the lines. In fact, if you want, lay your hand on your side and put your other hand on your shoulder, on the outside here, and lift your muscle, lift your arm up. And you will feel the entire deltoid contracting. When this muscle contracts right here, it lifts the arm. So the deltoid is the main abductor of the arm. Okay? So when the deltoid contracts, it abducts the arm. And you can see by the action line, that's exactly what it's going to do. It's going to pull it this direction, because here's your humerus down here. It's going to pull this thing up, away from your body. And it does. You can feel that muscle contract. Now, if your arm's out here, now you relax your arm, pull it back into your body. That deltoid doesn't contract anymore. What contracts is your pectoralis major right here across your chest. So when you lift your arm up, you feel your deltoid pushing out your action line. And now when you pull it back down, you feel your pectoralis major contracting to pull it back in. Okay, so opposite muscles for extension and flexion as it moves the arm, or abduction and adduction in this case. Right? And those are your action lines. That's where they're important. Okay, these are your spurt and shunt muscle. Your shunt muscles are your major ones. Again, if you can see your action lines here. If you contract your bicep muscles, if this shortens, this angle becomes less. If this muscle pulls here, this angle becomes greater. Okay, look how they're situated. You contract your biceps brachii, and this thing has to contract. Your lower limb, the lower part of your arm, your forearm comes up. If you contract the triceps, which is the muscle behind it right here, this is going to pull this bone right here open. That's an extender. So the bicep brachii and the brachioradialis are flexing muscles. Extension muscles, your triceps brachii. Okay? When your biceps are flexing, your triceps are acting as shunt muscles, help stabilize the joint. When your triceps is flexing and you're extending your muscle, the biceps are actually going to stabilize the joint. Okay, so spurt muscle is your main mover. Your shunt muscles are one that are acting to help stabilize the joint as it's being moved. You just look, if you look at the picture, you can tell. Let me get some of these lines out of the way. Okay. So this is your biceps brachii out here. It's bicep because there's two heads. And this is where it attaches. And you can see when this pulls along this action line, this angle is going to become smaller. It's going to pull that lower your forearm up. Okay. When the other one, the triceps flexes, when this becomes shorter, see where it's attached right here? It's going to pull this direction. So the angle here is going to increase. So those are extenders. Okay. So muscles associated with the pectoral girdle and the upper limbs are divided into 4 groups. Muscles that position the pectoral girdle, position your shoulder, muscles that move your arm, muscles that move the forearm and your hands, and muscles that move your hand and your fingers. Those are your different groups. Okay. Muscles coordinate with the muscles that move the arm, the levator scapulae. This elevates the scapula. Pectoralis minor protracts your shoulders. Okay, you got protraction and retraction. I think the next one shows you. Retraction is when your shoulder, I'm pulling the wrong one. Your shoulders are pulled back. Protraction is when your shoulders are pushed forward. So protraction, you're pushing your shoulders together. Retraction, pulling your shoulders back. And that deals with the scapula as it moves back, yeah. So protraction and retraction. Now, if you ever have a patient comes in the emergency room or comes in your clinic and they can take their shoulders and go protraction and actually touch their shoulders together. Okay, there's some kids that can do that. It's not double jointed. Is they can take these shoulders and they can touch them together. Okay, take a dental x-ray. They will have many teeth in their mouth. I mean, I'm talking about 60, 65 teeth. Teeth everywhere through their whole jawbone. Okay, it's a condition called cleidocraniodysostosis. I had one case come in my office in 30 years been doing dentistry. He came in the office, I took the x-ray and there were teeth everywhere. And I looked at that kid and I go, I'll bet you can touch your shoulders together. And he looked at me just amazed. He goes, how did you know that? And he can bring both his shoulder tips together. One of the conditions of multiple teeth like that is they're missing collarbones. They're missing their clavicles. They don't have clavicles. They take their shoulders, they can bring, only that keeps your shoulders apart are your clavicle bones. So when those muscles contract and make it together, your shoulders can contract and the shoulders actually touch each other. So you ever have a kid come in that can touch your shoulders, take a dental x-ray and tell them, I'll bet you got a lot of teeth everywhere. And they will have a lot of teeth. It's called cleidocraniodysostosis. And I remember I'll bring a picture of it, but it's unbelievable the amount of teeth they have in their mouths. I mean, they have teeth everywhere.
Is it dangerous?
What?
Can it be dangerous like that?
No, not really. It's just, you can't take them out because you'd have no jawbone left. They're everywhere. Okay, it's not I think there's a heart murmur associated with it also. If I'm trying to remember the rest of the diagnosis, I remember those 2 things. But I'll look it up on our break and try to get some pictures of it. It's really amazing. It's really neat.
That doesn't sound too neat.
No, it doesn't. Not for the patient, but if you were you can count like 30 teeth. I mean, they're everywhere. It's crazy. All right, so here's our levator scapulae. You can see what's going to pull up. Pectoralis minor is below the pectoralis major. It pulls in the same direction. And that tends to adduct the arm. Again, the deltoid is one that abducts the arm, ABD. The pectoralis major is one that adducts the arm, it's ADD. Okay, muscle position pectoral girdle. You have the rhomboid major and the rhomboid minor. The rhomboid major adducts the scapula. The rhomboid minor also adducts the scapula. Adducts means to move away from the midline of your body. I'm sorry, I said it backwards. Adduct means to pull it within towards the midline. Abduct means to move it away from the midline. Sorry about that. So your rhomboid major, rhomboid minor adduct the scapula, bring everything back in towards the middle. Okay? And these are the different motions your scapula can go through. You can have elevation, where they lift straight up. You can have depression, where they lift down. You can have adduction, Okay, adduction means move towards the midline. You see where it constricts and it moves your muscles towards the midline. Abduction means to move away from the midline. Then you can have upward rotation and downward rotation. And those are the rotations allowed through the shoulder joint. Okay. This is your rhomboid minor and rhomboid major. And again, just like the zygomaticus minor and major, the minor one is superior to the major one, and the minor one is smaller than the major one. So this is a rhomboid minor right here, and this is a rhomboid major. And you can see when they contract, what's the scapula going to do? Look at it. What's the action line going to be? The action line that this muscle shrinks, because this is stable, this is the vertebral column, that's bone. It's going to pull towards that bone. So when both the rhomboid minor and the rhomboid major contract, it's going to adduct the scapula. It's going to pull it closer to the midline. It has to. That's the action line of the muscle. Okay. Okay, we also have the serratus anterior, which protracts the scapula. Again, when you pull your shoulders back, and the subclavius muscle, which protracts the scapula, and the trapezius, which is a huge muscle on your back, and that rotates the scapula. Okay. So if you look at those muscles, protraction and retraction again. Okay, and this is the trapezius. Again, this muscle extends, makes the shape of a trapezoid around your back. Okay, this is the serratus anterior muscles on both sides here. Okay, and that's going to pull the scapula back away from the vertebral column. And then your serratus anterior on both sides. Okay, and the trapezius slinging up from the back. And the subclavius muscle. That's where they're located. All right, these are some videos which I'm gonna have to try to run a little different here.
The pectoral girdle
Good.
refers to the bony arch formed by the
Okay,
clavicle and the scapula. The primary function of the pectoral girdle is to act as an attachment point for the muscles that provide arm movement at the shoulder joint. It also provides the only connection between the arm and the axial skeleton.
Okay. There's about 5 of these videos. They're actually really good videos.
The muscles that act on the pectoral girdle, specifically the scapula, can be divided into anterior and posterior groups. 2 muscles comprise the anterior group, the pectoralis minor and the serratus anterior. The pectoralis minor muscle originates on the anterior surfaces of ribs 3 to 5 and inserts on the coracoid process of the scapula. The serratus anterior muscle originates from ribs 1 to 8 and inserts on the anterior vertebral border of the scapula.
Okay.
There are 4 muscles that comprise the posterior group: the levator scapulae, the rhomboid minor, the rhomboid major, and the trapezius. The levator scapulae muscle originates on the transverse processes of vertebrae C1 through C4 and inserts on the medial border of the scapula just superior to the spine of the scapula. The rhomboid minor muscle originates on the spinous processes of vertebrae C7 through T1 and inserts on the medial border of the scapula at the level of the spine of the scapula. The rhomboid major muscle originates on the spinous processes of thoracic vertebrae 2 through 5 and inserts on the medial border of the scapula inferior to the spine of the scapula. The trapezius muscle originates on the external occipital protuberance, the medial 1/3 of the superior nuchal line, and the spinous processes of vertebrae C7 through T12. Insertion of the trapezius muscle makes a continuous line from the acromion and spine of the scapula to the lateral 1/3 of the clavicle.
It gives you a lot of detail of how these muscles are attached here.
The scapula of the pectoral girdle is loosely attached to the thoracic cage and consequently capable of considerable movement. To best illustrate the scapular movements, 6 actions of the scapula will be animated. Lateral rotation, or raising of the glenoid cavity. Medial rotation, or lowering the glenoid cavity. Elevation. Depression.
Uh-oh.
Protraction. And retraction. Lateral rotation of the scapula results from contraction of the serratus anterior and the trapezius muscles. Medial rotation results from the contraction of the levator scapulae and the rhomboid major and minor muscles. Elevation of the scapula occurs through the levator scapulae, the major and minor rhomboids, and the trapezius muscles. Depression of the scapula is caused by the serratus anterior and the trapezius muscles. Scapular protraction is caused by the serratus anterior and the pectoralis minor muscles. Scapular retraction is caused by both rhomboids and the trapezius muscle.
The trapezius is the large trapezoid-shaped muscle located in the posterior thorax and neck. It may be separated into 3 groups of fibers: superior, middle, and inferior. The origins of the superior fibers are from the external occipital protuberance, the superior nuchal line, the ligamentum nuchae, and the spinous process of vertebrae C7. The insertions are to the lateral 1/3 of the clavicle and acromion of the scapula. With the origin fixed, the superior fibers elevate the scapula, gliding it toward the skull. The superior fibers also laterally rotate the scapula upward. With the insertion fixed and the muscle contracting on one side only, the superior fibers laterally flex and rotate the head and neck to the opposite side. With the insertion fixed and the muscle contracting on both sides, the superior fibers extend the neck. The superior fibers are innervated by the spinal accessory nerve. The origins of the middle fibers are from the spinous processes of vertebrae T1 through T5. The insertions are to the medial border of the acromion and the superior lip of spine of the scapula. With the origin fixed, the middle fibers adduct the scapula. This is a gliding movement toward midline. The middle fibers are innervated by the spinal accessory nerve. The origins of the inferior fibers are from the spinous processes of vertebrae T6 through T12. The insertion is to the tubercle of the spine of the scapula. With the origin fixed, the inferior fibers depress the scapula, gliding it inferiorly. The inferior fibers also laterally rotate the scapula upward. The inferior fibers are innervated by the spinal accessory nerve.
So muscles that move the arm. You have an anterior view, which is your deltoid, and your pectoralis major. We said those are the exact opposite muscles. One's anergist, one's a synergist, one's an anergist muscle. So the deltoid abducts your arm, takes it away from the midline of your body. Again, you always just put your arm on your deltoid and lift up, you feel the muscle contract. Pull down, and you feel your pectoralis major contract. So the deltoid abducts the arm, the pectoralis major adducts the arm, and also medial rotates it toward the midline. Okay, so here's the deltoid muscle. And you can see when you contract this muscle right here, this is going to raise up because this muscle is going to pull. This is your pectoralis. When this pulls, you can see the arm's going to come that direction. If you look at the action lines, you can tell because the muscles all they can do is shorten along their long axis. So all you do is draw a line where the fibers are, and you see which direction they're going to pull. And you know if the shoulder joint right here is stable, the arm's going to raise because the shoulder joint can't go anywhere else. And if you're basically on the pectoralis major, you go to your manubrium of your sternum. Okay, that's not going to move, so the arm's going to move back towards the sternum. So it depends on your anchor points and the action lines of those muscles. Okay, the anterior view of it, you have the coracobrachialis muscle, biceps brachii, the teres major, and the subscapularis. The coracobrachialis muscle adducts at the shoulder, okay, brings the arm back to the midline. The bicep brachii, the short head and long head, flex the lower arm. They decrease that angle. The teres major, extension and medial rotation of the shoulder. And the subscapularis is medial rotation at the shoulder. Again, you'll see the muscles where they're situated. This is the subscapularis muscle. You can see what it's going to do when it contracts. The coracobrachialis is this muscle behind the biceps right here. Then your teres major is to the side here. And your biceps brachii, when this contracts, it takes this joint and moves it up, flexes it at the elbow. Okay. In the posterior view on the arm, backside of it, you have the supraspinatus muscle, which is abduction at the shoulder. Again, that's what the deltoid muscle does. Deltoid muscle is abduction at the shoulder. And latissimus dorsi run the back, and those are adduction. They bring it in, back towards the midline and medial rotation. So if you look at those, again, the deltoid muscle, you know exactly how that contracts. The supraspinatus, the same way. Both of those contract, they're going to act to move that arm away from the midline. And latissimus dorsi is 90 degrees to those. Okay? It's going to contract. This is a stable point, so it's going to pull that direction. It's going to abduct the arm. Okay, so your supraspinatus and your deltoid are going to abduct the arm. Your lateral latissimus dorsi are going to adduct the arm. Okay, adduct is adding it, bringing it towards the middle. Abduct is moving it away. Okay. You also have in the posterior view the supraspinatus muscle, the infraspinatus, the teres major, teres minor, and the triceps brachii. Okay, the supraspinatus is going to abduct at your shoulder. Again, move it away from the midline. The infraspinatus is going to be lateral rotation. Teres major is going to extension, medial rotation. Teres minor is going to adduct and lateral rotation. And the triceps brachii is going to be extension of the lower arm. The biceps brachii and the triceps brachii work exactly opposite each other. When the bicep brachii contracts, the arm flexes. When the triceps brachii contracts, the arm extends. Okay, so again, here's the supraspinatus muscle. These are your supraspinatus on both sides. Your infraspinatus, okay, teres minor, teres major, and these are the triceps. You can see the action lines when they contract, what they're going to do. Okay, we talked about action lines. My computer catch up here. So when a muscle contracts, it develops tension. It shortens. Okay, the direction the muscle moves, okay, is the direction that's developing tension is what's called our action line. And that's what we use to predict what's going to happen. What muscles are going to rotate, where arms are going to go, where your limbs are going to end up. Okay, so action lines that cross the anterior part of a joint are flexors. So look at you, take your arm and go in the anterior part of that. If those muscles contract, they're going to decrease that angle. Okay, those are your flexors. Posterior aspects of a joint, if they contract, they're going to extend it. An anterior muscle of the joint is like your biceps brachii. That's a flexing muscle. Posterior is the triceps brachii. That's an extender. The medial aspect of a joint are adductors. They bring it back to the midline. Lateral aspect of a joint are abductors. Move it away from the midline. Okay? Those are your 4 basic movements around the shoulder joint. Okay? And again, we saw this before. This is your deltoid muscle. And if this contracts and deltoid muscle contracts, this is going to abduct. If the bicep muscles contracts, this is going to flex. If the tricep muscles contract, that's going to extend. Okay? That's what you can do with action lines. You can tell where it's going to move the bones to when they contract. And let's do a series of these other ones. And what does that move the arm?
The
Okay.
latissimus dorsi is the large triangular-shaped muscle of the upper limb, which has an extensive origin from the posterior thorax and abdomen. The origins of the latissimus dorsi are from the posterior lip of the iliac crest. The spinous processes of vertebrae L5 through T7 and ribs 8 through 12 via the thoracolumbar fascia. The insertion is to the intertubercular groove of the humerus. Latissimus dorsi extends the arm at the shoulder. From a state of flexion, it moves the arm to an anatomical position or to a state of extension, and beyond this to a state of hyperextension. It also adducts the arm by moving it in a medial direction toward the mid-sagittal plane, and medially rotates the arm by turning the anterior surface of the arm toward midline. Latissimus dorsi is innervated by the thoracodorsal nerve.
There's one more video on this one.
The pectoralis major is the large superficial muscle of the arm located in the anterior thorax. It may be separated into 2 groups of fibers, superior or clavicular and inferior or sternocostal. The origin of the superior or clavicular fibers is from the anterior surface of the medial 1/2 of the clavicle. The insertion is to the lateral lip of the intertubercular groove of the humerus. The origins of the inferior or sternocostal fibers are from the anterior surface of the sternum, the costal cartilages of ribs 1 through 7, and the aponeurosis of the external oblique muscle. The insertion is to the lateral lip of the intertubercular groove of the humerus. Acting as a whole, the key actions of the pectoralis major are medial rotation and adduction of the arm. Medial rotation is a movement during which the anterior surface of the arm turns toward midline. Adduction is a movement in a medial direction toward the mid-sagittal plane. The pectoralis major also assists in flexing the arm at the shoulder.
All right, muscles of the pectoral girdle and the upper limbs. We can continue with that. So muscles that move your forearm and your hand now. Most of these muscles originate on the humerus and insert onto the forearm and the wrist. Okay. Exceptions to that rule. The long head of the triceps brachii originates on the scapula and inserts on the olecranium of the ulna. And the other one is the long head of the biceps brachii, originates on the scapula and inserts on the radial tuberosity of the radius. So those are 2 exceptions. Again, the triceps brachii is called triceps brachii because it has 3 heads. Biceps brachii has 2 heads for its attachment. All right. So muscles that move your forearm can be your biceps brachii. You flex at the elbow and the shoulder. Brachialis flexes at the elbow, and the brachioradialis flexes at the elbow. You see here, this is your biceps brachii, and it connects up in here, and it flexes at the shoulder and at the elbow joint. Here's your brachioradialis. Oops, what did I hit? I think I went too far back. Okay. Right there. Biceps brachii, brachialis at the elbow joint, and your brachioradialis at the elbow joint. All right, in the anterior view, muscles that move the hand now. Okay, You have your flexor carpi radialis, which flexes and abducts the wrist. You got your palmaris longus, which flexes at the wrist. And you got your flexor carpi ulnaris, which flexes and adducts the wrist. Okay, so take a look at those muscles here. And when you're dealing with movements of the wrist joint, remember the anatomical position. Anatomical position is the body being in the supine position, lay down, your palms are face out. If you move your wrist, okay, and the thumb leads the way, that's a lateral rotation. Because if you look at it, you put your hand in the anatomical position and you move towards your thumb, that's going away from the midline. So that's lateral movement. Everything refers back to the anatomical position. If you put your hand down at your side with your palm facing out and you move it following your little finger, okay, that goes towards the midline of your body. That's medial rotation, okay? So this is your lateral rotation when you follow the thumb, medial rotation when you follow the little finger, when you're doing with rotation of your hand. Okay, and you can see the flexor carpi radialis, the palmaris longus, and the flexor carpi ulnaris as they innervate into the hand and allow the hand to rotate. Okay. The anconeus gives you extension at the elbow. The triceps brachii, the lateral head, is extension of the elbow. The long head is extension of the elbow and adduction at the shoulder. And the medial head is extension at the elbow. So when you contract, because that's in the posterior section, when it contracts, it causes extension of that elbow joint. Okay, so here's the aconeus muscle. Again, when this contracts, it's going to pull that way. It's going to make this angle expand. That's extension. Here's your triceps, two heads of the tricep brachii. Again, when these pull, when these contract, it pulls this direction. And this pulls right here, this muscle this direction. Okay, and the arm will extend. So those are extensor muscles. This is the tricep brachii medius and the triceps as it wraps around. So it comes through here, and as that it contracts at this joint here, it's going to pull it that direction. Okay. Muscles that move the hand. You have the extensor carpi radialis longus, extensor carpi ulnaris, and extensor carpi radialis brevis. Okay, the extensor carpi radialis longus, extension and adduction at the wrist. Extensor carpi ulnaris, extension and adduction at the wrist. Extensor carpi radial brevis is extension and abduction at the wrist. And these are the muscles you can see here. This is extensor carpi radialis longus as it extends down to the hand. Extensor carpi ulnaris from the ulna, and extensor carpi radial brevis from the radius. Okay, those are all extensors at the wrist, cause the wrist to extend. We got some more muscles from the forearm.
The elbow joint is a hinge joint. Therefore, the muscles that act on this joint are limited to flexion and extension of the forearm at the humero-ulnar joint, while the forearm itself is capable of pronation and supination.
Okay, these are about 6 shorter videos here.
Muscles that extend the forearm are located posteriorly, while those associated with flexion of the forearm are located anteriorly.
Like I said, the anterior muscles of the forearm are the brachioradii, the biceps brachii. The extensions, the posterior section is the triceps radii. Anterior muscles flex, posterior muscles in that section extend.
The forearm flexors consist of the brachialis, the brachioradialis, and the biceps brachii. The brachialis muscle originates on the front distal half of the humerus and inserts on the coronoid process of the ulna. The brachioradialis originates on the lateral supracondylar ridge of the humerus and inserts on the base of the styloid process of the radius. The biceps brachii has two parts, a long head and a short head. The short head originates on the coracoid process of the scapula, while the long head originates on the supraglenoid tubercle of the scapula. The two heads of the biceps come together distally to insert on the radial tuberosity, just distal to the elbow joint. The forearm extensors consist of the anconeus and the triceps brachii. The anconeus originates on the lateral epicondyle of the humerus and inserts on the olecranon process of the ulna. The triceps brachii is a three-headed muscle with the long head originating on the infraglenoid tubercle of the scapula, and the lateral and medial heads originating on the posterior shaft of the humerus. The heads come together distally to insert on the olecranon process of the ulna.
Biceps brachii is the large two-headed flexor muscle located in the anterior compartment of the arm. The origin of the long head is from the supraglenoid tubercle of the scapula. The origin of the short head is from the tip of the coracoid process of the scapula. The two heads insert by a common tendon onto the radial tuberosity and by the bicipital aponeurosis, which blends with the deep fascia on the medial aspect of the forearm. Biceps brachii flexes the forearm at the elbow supinates the forearm, and weakly flexes the shoulder. It is innervated by the musculocutaneous nerve. Triceps brachii is the large extensor muscle located in the posterior compartment of the arm. It has three heads of origin: the long head, the lateral head, and the medial head. The origin of the long head is from the infraglenoid tubercle of the scapula. The origins of the lateral head are from the posterior and lateral surfaces of the superior one-half of the humerus. It is located both superiorly and laterally to the radial groove. The origins of the medial head are from the inferior two-thirds of the medial and posterior surfaces of the humerus and is located inferiorly to the radial groove. Together, the three heads insert onto the superior and posterior surfaces of the olecranon process of the ulna. Triceps brachii extends the forearm at the elbow. It is innervated by the radial nerve.
So a muscle, we're talking muscle with the hands and fingers, the extrinsic muscles of the hand. Remember, extrinsic means the big muscles, the large muscles, the ones that are giving the power. So extrinsic muscles are relatively large muscles. Okay, they perform flexing and extension at the joints and at your fingers. Okay, they provide strength and crude control of your hand and fingers, and they're found mostly in your forearm, where they're going to extend down. Those are mostly your larger, bigger muscles. Okay, intrinsic muscles of your hand. These are your smaller muscles. Okay. They provide very fine control. They're responsible for flexing and extension, abduction, adduction of the fingers at the metacarpal phalange joints. We have real fine detail control in using your fingers. Responsible for opposition and reposition of your thumb. Okay? They're found mostly in the palm or the dorsum of your hand. Okay? So the intrinsic muscles are within the hand. The extrinsic muscles are in the forearm. Okay, the different muscles. Flexor digitorum superficialis is flexing at the wrist in some digit. Flexor digitorum profundus is flexing at the wrist in some digits. And the flexor pollicus longus is flexion of the thumb. Remember, pollex is the thumb. So when you have pollicus in there, you know this muscle is going to, this is a flexor pollicus longus, a long muscle that flexes the thumb. So you know what it does. And you can see the different muscle attachments here, the flexor digitorum superficialis, and you have the flexor pollicus longus. Okay, and the flexor digitorum profundus. Again, this one you see innervates the thumb here, and it's going to allow you to flex the thumb. Okay, again, look at the different ones. You have the adductor pollicus longus, which abducts the thumb. Okay, so it tells you right in the name what it's going to do. Abductor pollicus means abduction of the thumb. Extensor digitorum extends the digits. Extensor pollicis brevis extends the thumb. Okay, so this is extension muscle of the pollicis of the thumb. Okay, extensor digita minimi. Minimi means the little finger, your pinky. Okay, so whenever you see that on an exam, you know it's dealing with the pinky. So extensor digital minimi is an extension muscle that extends the digit of the little finger. And this is extension of your little finger. So that way you don't have to memorize everything, you just know what it's talking about. When you see pollex, that's your thumb. When you see minimi, that's your pinky or your little toe. When you see hallux, that's your big toe. Okay? Those are the Latin words for it that you can use to identify what they're going to cause. So again, the extensor digitorum, large extensor muscle here is going to extend the digits. Okay, extensor digital minimi, it's going to extend down to the little finger. Pollicus, abductor pollicus brevis is going to extend into your thumb and cause abduction. And extensor pollicus brevis is going to cause extension of your thumb. So one abducts your thumb, one extends your thumb. Okay, and it's all right in the name. Intrinsic muscles of the hand, the ones that are fine control. Abductor pollicus. If you had to guess, it's an adductor of the thumb. That's what it does. It adducts the thumb. Flexor pollicus brevis flexes the thumb. Flexes and adducts the thumb. Opponens pollicus is opposition of the thumb. Allows the thumb to oppose other fingers. Abductor pollicus brevis abducts the thumb. Okay, just by knowing the terms, you know what the muscles do. You can see where they attach. The adductor pollicus, you see when it pulls here, it's going to pull in this direction. The flexor pollicus brevis is going to take this thumb and it's going to pull it this way. It's going to close that angle, make the angle less. That's a flexor. Opponens brevis runs this direction to the thumb and allows the thumb to oppose the other fingers. The abductor pollicus brevis is going to act in this direction here and allow you to abduct the thumb. Okay, move it away from the midline. Oops, wrong button. Okay. Flexor digital minimi brevis. Okay, flexes the little finger. Once you see minimi, you know it's on the little finger. Palmaris. Okay, you know that's the palm of the hand. Moves the skin on the medial side of the palm. Abductor digital minimi abducts the little finger. Opponens digital minimi brings digits into opposition with the thumb, with the little finger, and brings it around so you can bring that into opposite with your thumb. And there's the muscles, the adductor digital minimi, the flexor digit time minimi brevis, opponens digital minimi, and the palmaris brevis, which is the cut muscle right here. This one here goes across the palm. Okay, more intrinsic muscles of the hand. Within the hand itself here, you have the lumbricals. The lumbricals are responsible for flexion of your digits. The dorsal interosseous is abduction of digits 2 through 4. And the palmar interosseous is adduction of digits 2, 4, and 5. Again, here's your lumbricals. They're located in between the fingers here, and they cause the flexion of those digits. The palmaris interosseous comes across here, and then the first dorsal interosseous is there. Between each of the digits has a dorsal interosseous.
Flexor digitorum superficialis is one of the superficial flexor muscles occupying the anterior compartment of the forearm. Flexor digitorum superficialis has 3 heads: the humeral head, the ulnar head, and the radial head. The origin of the humeral head is from the common flexor tendon of the medial epicondyle of the humerus. The origin of the ulnar head is from the medial side of the coronoid process of the ulna. The origin of the radial head is from the oblique line of the radius. The insertion is by 4 tendons to the middle phalanges of digits 2 through 5. Flexor digitorum superficialis flexes the proximal interphalangeal joints of digits 2 through 5. It assists in flexion of the metacarpophalangeal joints and in flexion of the wrist. It is innervated by the median nerve.
All right, compartments and sexual anatomy of the arm and the forearm. Okay, we have dense connective tissue. Provides a structural framework for the soft tissue of the body. Okay, the connective tissue fibers of the deep fascia support the interconnection adjacent to skeletal muscles and permit independent movement of those muscles so they can slide past one another. The deep fascia extends between the bones and the superficial fascia and separates the soft tissue of the limb into separate compartments. Okay? So that's what the deep fascia does. They have different compartments that these fascia lines, this connective tissue, breaks the body into. So compartments of your upper limb. In the arm, you have the anterior compartment, which we talked about were flexors, like your brachioradialis. We have the posterior compartment of the arm, which are your extensors, like the tricep brachii. The forearm, the anterior compartment, are superficial and deep. You have a lateral compartment and a posterior compartment. So an anterior compartment, lateral, and posterior compartment on the forearm. Okay, the anterior compartment of the arm consists of the bicep brachii, those are your flexors, brachialis, and coracobrachialis. The posterior compartment is your triceps brachii, those are your extensors. Oops, wrong button. If you look at the cross sections, again, cross sections are very difficult to read. It takes lots of practice to understand what you're looking at. But you can see the different compartments by how they're divided. Okay, so this here is your posterior section. This is your anterior section. Your anterior sections are your flexors, biceps brachii, coracobrachialis. Your posterior section is your triceps brachii. This is your extensors. And the deltoid is the lateral section out here. Again, your flexors, your brachialis, biceps brachii. Anterior superficial compartments. You have the flexor carpi radialis, flexor carpi ulnaris, so where one comes in the radius, one comes in the ulna, the flexor digitorum superficialis, the palmaris longus, pronator teres, the flexor digitorum profundus, and the flexor pollicus longus. If you had to guess at the flexor pollicus longus, what would you think that does, just from the terms that you know?
Flexes the pollex.
Yep, flexes the pollex, flexes the thumb. Perfect. Okay, again, cross sections are very difficult to look at the muscles, exactly what it is. But this is a flexor digitorum. But you can see how they divide up into sections with the deep fascia, and that allows the muscles to contract and actually slide past one another and how they're developed. Again, you can have an anterior component and a posterior component to it. And the muscles we talked about were the flexor digitorum profundus, the flexor carpi ulnaris, flexor digitorum superficialis, and the palmaris longus. And then the flexor pollicus longus. This is the one that innervates into the thumb right here and causes it to flex. Okay. This is a cadaver specimen of them. And it's kind of difficult to see, but you see the flexor carpi ulnaris. Okay. The palmaris longus. Let's see if I can make this bigger. Oops, I couldn't make it bigger. I lost something. Didn't allow me to extend that one. Nope. It's not going to let me do it. Oh, maybe. How's that? Is that better? Okay, perfect. So you see your flexor carpi ulnaris. You can see the palmaris longus, the flexor superficiatorum, and the flexor digitorum profundus along the side. See if I can shrink it back again. Hit play. Okay. I think that's where it was. All right, so compartments you form. The anterior deep compartment, you got your pronator quadratus. The lateral compartment, you have your brachioradialis, your extensor carpi radialis brevis, your extensor carpi radialis longus. Brevis is just short, longus is long. 3 different muscles. So here's the brachialis. Okay, extensor carpi brevis. And that's in your anterior compartment. Posterior compartment. Okay, you have your abductor pollicis longus and coneus muscle, extensor carpi ulnaris, extensor digitorum, extensor digiti minimi, extensor indicus, extensor pollicis brevis, extensor pollicis longus, and the supinator. And there's all the muscles. Like I said, I don't expect you to know the cross sections right now. It's very hard to look at that and say what muscle that is, just at a cross-sectional view. But you see the different muscles and where they extend into. The abductor pollicis longus innervates into the thumb or the pallix. Extensor digitorum extends your digits. Extensor digitorum minimi extends the little finger. Extensor carpi ulnaris branches off from the ulna bone. Okay. Those are your posterior sectional groups. You can see how you divide the anterior, posterior, and then divide in different sections with the deep fascia. The muscles of the lower limb, okay? Since we're doing the upper limb now. Now the lower limb. Muscles of the lower limb are larger, more powerful than those of the upper limb because they got to support your entire weight, your entire body. They can divide into 3 groups. Muscles that move your thigh, muscles that move your leg, and muscles that move your foot and your toes. Okay? Muscles that move the thigh originate on your pelvis. Okay, many of those are large and they're very powerful muscles. There's 4 groups of those that originate on the pelvis and very large muscles that move your thigh. They're your gluteal groups, your lateral rotator group, your adductor group, and your iliopsis group. Okay, the gluteal group contains 4 muscles. Okay, the gluteus maximus, which causes posterior extension at the hip. They contain the gluteus medius, which is abduction at your hip. They contain the gluteus minimus, which is abduction at your hip, moving away from the midline. And the tensor fasciae latae, which is abduction at your hip. Okay. If we take a look at them, you have your gluteus maximus, which is a large muscle of your rear end here. You can see that muscle is cut from this point right here. That's your gluteus maximus. Okay. Gluteus minimus is below it, runs at a different angle. And that's the gluteus medius, and the gluteus minimus is below that. Then the tensor fasciae latae is on the side as it runs down. Okay. You have the lateral rotator group, which is your obturators, your piriformis, gemelli, and the quadratus femoris. Your obturators are lateral rotation and abduction of your hip, okay, moving away from the midline. The piriformis is a lateral rotation and also abduction of your hip. The gemelli is a lateral rotation and abduction of your hip. And the quadratus femoris causes just lateral rotation of your hip. Okay, so you can see the piriformis runs in this direction. The gemellus runs in this direction. Obturator in turn run in this direction. And the quadratus femoris. You can see all those muscles are going to contract to abduct, move away from the midline of the hip by looking at their action lines. Okay. The adductor group, bring the leg back in towards the midline, is the adductor brevis, the adductor longus, the adductor magnus, the pectineus, and the gracilis. Okay? And all of those cause adduction of the hip. Bring it back in towards the midline for the leg. Okay, and look at the lines. Here's the muscle where they attach. All these are gonna sling that muscle back in that direction to bring it this direction towards the midline. Okay, so your adductor magnus, adductor brevis, adductor longus, pectineus, and gracilis all act to adduct the hip muscle. Bring that leg back in towards the midline of the hip. The iliopsoas group is the iliacus, which causes flexing at the hip, and the psoas major, which is also causes flexing at the hip. Okay, here's just your psoas muscle here. This is going to bring it in. This is going to allow the hip to flex. When it contracts, moves the hex and decreases the angle between that joint. And the iliacus is also going to run that same direction when it contracts. And the iliacus connects all the way across the crest of the iliac bone.
The gluteus maximus is the large fleshy muscle that forms the bulk of the buttock. The origins of gluteus maximus are from the posterior ilium, sacrum, coccyx, and the sacrotuberous ligament. Some deep fibers insert onto the gluteal tuberosity of the femur. However, the majority of the fibers insert onto the iliotibial tract of the fascia lata. The gluteus maximus is the most powerful extensor of the thigh at the hip. It also assists in lateral rotation of the thigh. It is innervated by the inferior gluteal nerve. Iliopsoas is one of a group of 9 flexor muscles that cross the hip joint. It consists of 3 separate muscles, the psoas minor, the psoas major, and the iliacus. Psoas minor is quite small, often absent, and is thus considered an unimportant member of the group. The origins of psoas major are from the vertebral bodies, transverse processes, and intervertebral discs of T12 through L5. The fibers run inferiorly and pass behind the inguinal ligament. They then wrap around the femoral head to insert onto the lesser trochanter. The origins of iliacus are from the superior 2/3 of the iliac fossa, the internal border of the iliac crest, and the ala of the sacrum. The fibers converge to insert onto the lesser trochanter with the psoas major tendon. The shared tendon is known as the iliopsoas tendon. With the origin fixed, the iliopsoas flexes the femur onto the trunk. With the insertion fixed and acting bilaterally, it flexes the trunk onto the femur. Psoas major is innervated directly by the lumbar plexus, while the iliacus is innervated by the muscular branch of the femoral nerve.
So muscles of the pelvic girdle and lower limbs, muscles that move the leg. Extensors of the knee. Remember, extensors cause the angle between the joint to increase. Flexors cause the angle of the joint to decrease. So extensors of the knee, your quadriceps femoris, okay, which is composed of 4 muscles. Those are quadriceps femoris is a group of 4 muscles called the vastus intermedius, and all of them are going to extend the leg. Vastus lataris, vastus medius, and the rectus femoris. And the rectus femoris also causes flexion at the hip, in addition to extending the leg. Okay, so there's the rectus femoris, the vastus lataris, and the vastus medius. Again, it's the medial side, lateral side, and one goes right down the middle. Flexors of the knee decrease the angle. Okay, biceps femoris, which flexes the leg, extension causes extension at the hip. Semimembranosus flexes the leg. Semitendinosus also flexes the leg. So the bicep femoris, semimembranosus, and the semitendinosus, those are your hamstring muscles. Those 3 muscles make up the group referred to as your hamstrings. Okay, so hamstrings are your biceps femoris, your semimembranosus, and your semitendinosus. And they flex the leg, decrease the angle at the knee. Okay, so here's your biceps femoris. Here's your biceps femoris short head. Here's a semimembranosus. You see when all those muscles contract, it's going to flex or bring this knee back up and decrease that angle. Okay, flexors of the knee, also the sartorius, which allows you to cross the lower leg, cross your lower leg over your other leg. And the popliteus flexes the leg. Okay, this is the sartorius muscle here that swings around from the iliac crest, comes down and crosses over the knee. So that allows you to pick your leg up and cross over to the other leg. That's your sartorius muscle. You can see where it extends down all the way down to here. So it comes across one side and flexes across. It allows you to bring your legs over one another because of the way it runs. And the popliteus muscle goes across the popliteal, the kneecap.
Vastus lateralis is the lateral member of the muscle group of the anterior thigh known as the quadriceps femoris. The origins of vastus lateralis are from the greater trochanter, the intertrochanteric line, and the lateral lip of the linea aspera of the femur. The fibers run inferiorly to insert onto the quadriceps femoris tendon, the superior and lateral borders of the patella, and to the tibial tuberosity via the patellar ligament. The vastus lateralis extends the leg at the knee. It is innervated by the femoral nerve. Biceps femoris is the lateral member of the muscle group located in the posterior thigh, known as the hamstrings. Biceps femoris has two heads, the long head and the short head. The origin of the long head is by a common tendon with a semitendinosus from the superior and medial surfaces of the ischial tuberosity. The origins of the short head are from the lateral lip of the linea aspera and the lateral supracondylar line of the femur. The fibers run inferiorly and laterally to insert primarily onto the lateral surface of the fibular head, but it also inserts on the adjacent surface of the lateral condyle of the tibia. Both heads of the biceps femoris flex the leg at the knee and laterally rotate the knee. The long head also extends the thigh at the hip. The long head is innervated by the tibial nerve. The short head is innervated by the common fibular nerve. The origin of sartorius is from the anterior superior iliac spine. The fibers run inferiorly and medially to cross the knee joint and insert onto the medial surface of the proximal tibia. Sartorius flexes the hip and knee joints and laterally rotates the hip joint. It is innervated by the femoral nerve.
Extrinsic muscles, just like with the hands, extrinsic are your big, powerful muscles, reaching up either up at the femur, extend down in, and the intrinsic ones are the very fine, controlling ones. So extrinsic muscle of the foot, muscles rated on the distal end of the femur or on the tibia and fibula, but move the foot and the toes. Intrinsic muscles, those fine ones are very fine control, originate on some aspect of the foot and yet move the toes. Okay, those are your shorter muscles in there. Okay, extrinsic muscles with the foot, the dorsiflexor muscles, which is your tibialis anterior, causes dorsal flexion of the foot to come up on the top of it. Okay, so here's the tibial tuberosity where it connects. Here's the tibia, which is the bone towards the front, and the tibialis anterior muscle, which is your dorsal flexor that comes down across here. And that's one of your extrinsic muscles, it's one of your large, powerful muscles that move the leg. Okay, extrinsic muscles that move the foot, your plantar flexors. Again, these are also extrinsic muscles. You got your gastrocnemius, the fibularis brevis, fibularis longus, plantaris, soleus, and the tibialis posterior. Okay, the gastrocnemius muscle is a plantar flexion of your foot. The fibularis brevis is eversion of your foot. Fibularis longus is eversion of your foot, and you roll it on the inside. Plantaris is a plantar flexion. Soleus is a plantar flexion. And tibialis posterior is the inversion of the foot. Okay. And again, you can see the plantaris muscle coming across. The gastrocnemius has a medial head and a lateral head. Okay. And the soleus is one that runs down the side. Okay, you can see from this is the anterior view, you can see from the back of it. This is a large soleus muscle here. Okay. And you can see the plantaris muscle running across there all the way down. Oops, wrong button. Okay, fibula, the plantar flexors, your fibularis longus and your fibularis brevis, and your tibialis posterior. Okay, extrinsic muscles that move your toes, again, gives you the power. They're usually bigger, stronger muscles. Digital flexors and extensors. So flexor digitorum longus flexes toes 2 through 5. Flexor hallucis longus flexes the hallux, which is the big toe. Extensor digitorum longus, extension of the digits 2 through 5. And extensor hallucis longus, a longus that extends the big toe, the hallux. Okay. Here's the flexor digitorum longus, where it's located, and the flexor hallucis longus. It comes down, this one's going to innervate into the big toe. Okay, extensor digitorum longus. How do we got marks on it? Oh, okay, extensor digitorum longus runs on the side there, and extensor hallucis longus comes out here and then runs down to innervate the large toe. Intrinsic muscles, remember the difference? Extrinsic are your big muscles, your powerful muscles originate from the femur or the radius and ulna and extend down into it. Your intrinsic muscles are your smaller muscles, your very fine control muscles. So you have an abductor hallucis, abductor hallucis muscle, which abducts the big toe, the hallux. The flexor digitorum brevis flexes your toes. The abductor digital minimi, which abduction, makes that little toe, moves it away from the other toes, away from the midline. The lumbricals, which is extension of your toes 2 through 5, just like on the hand we had. And the flexor hallucis brevis, okay, flexes of the hallux. Flexor digital minimi brevis, flexion of the little toe. So whenever you see pallux, you know it's the thumb. Whenever you see hallux, you know it's the big toe. Whenever you see minimi, you know it's the little pinky or the little toe, depending where you're located in the arm or the leg. So you can locate those areas. Okay, and the lumbricals run between the digits and flex all the digits. Okay, you got the flexor hallucis brevis, which flexes the big toe. And that's where it's connected. Flexor digital minimi brevis flexes the little toe over here. The abductor hallucis abducts the big toe. Flexor digitorum flexes your digits 2 through 4. You can see where all the branches are right here. You see when they contract, they shorten this direction and they pull the toes underneath and flex them. And the abductor digital minimi extends into the little toe and causes abduction of the little toe. Okay, muscles that move the toes, intrinsic muscles. Quadratus plantae, flexion of toes 2 through 5. Flexor hallucis brevis, which is flexion of the hallux. Adductor hallucis adducts the hallux. And plantar interossei, adduction of toes 3 through 5. Okay, so quadratus plantae. Okay, the abductor of the hallucis, okay, and the flexor hallucis. Okay, whether it's anterior, posterior, depends when they contract, what they're going to do, whether they're going to flex, close that angle, or extend, open that angle up. There's your plantar interossei for digits 2 through 4 right there, causing flexion of those. Okay. And more of those muscles. Extensor digitorum brevis extends toes, digits 1 through 4. Dorsal interossei, abduction of toes 3 through 4, extension of toes 2 through 4, depending where they're located when it contracts. Okay, so your dorsal interossei are the dorsal of the foot, the top part of your foot, and you can see how they bond here or attach to the digits 2 through 4. Again, you can see your extensor digitorum brevis, and these are your extensor muscles. When they come up here, you can see they go to the top of the toes, and when they contract, it pulls this direction, which is increases the angle here between the digit of the phalanges. Okay, that's your extensor digitorum brevis, small muscle between the digits causing extension.
The origins of extensor digitorum longus are from the lateral condyle of the tibia, the proximal 3/4 of the anterior surface of the fibula, and the interosseous membrane. The fibers run inferiorly to divide into 4 tendons that insert onto digits 2 through 5. Extensor digitorum longus extends the metatarsophalangeal joints of digits 2 through 5. It assists in extension of the interphalangeal joints of digits 2 through 5. It also assists in dorsiflexion of the foot. It is innervated by the deep fibular nerve. The origins of tibialis anterior are from the lateral condyle of the tibia, the shaft of the lateral tibia, and the interosseous membrane. The insertion is to the medial and plantar surfaces of the medial cuneiform and the base of metatarsal 1. Tibialis anterior dorsiflexes the foot at the ankle and assists in inversion of the foot. It is innervated by the deep fibular nerve. Soleus is located in the posterior compartment of the leg, deep to gastrocnemius. The origins of soleus are from the proximal 1/3 of the posterior fibula and the soleal line of the posterior tibia. Soleus passes inferiorly and merges with the deep layer of the calcaneal tendon, which inserts onto the posterior calcaneus. Soleus plantar flexes the foot at the ankle. It is innervated by the tibial nerve.
So action lines of muscle. Remember we talked about action lines. Action lines, when you look at a muscle, you can see what's going to bend, what's going to stay stationary. Muscle contracts is shortened. It's going to extend, flex, abduct, adduct, rotate, whatever it's going to do. But you can tell what it's going to do when you watch it develop its tension lines. And it develops tension when it starts to contract. So the direction the muscle moves depends on the tension is your action line. That's what we determine, that's what we watch. The following figures show action lines of muscles that move the thigh. Okay. So you can see when the muscle contracts, this is your adductor longus adduction, it's going to pull in this direction. Okay. So this bone is going to move this way because this is a fixed point up here. Okay. So the hip joint is just like the shoulder joint. It can move in many different directions. It's a synovial joint, and it allows flexing, extension, abduction, adduction, medial, and lateral rotation. And all it depends upon is what the action line, the muscle that contracts, what action line is going to move that, that part of the body. Okay. So in the lateral compartment, on the side, on the hip joint, okay, you have the fibularis longus and the fibularis brevis. Okay, a long muscle connected to the fibula and a short muscle connected to the fibula. Remember the fibula is on the side, in the back. The tibia is the front one, the fibula is in the back one here on the knee. Looking at the cross section, this is your fibularis longus. This is the lateral portion, looking at a cross section of it. Okay, fibularis longus is easier to see here than the cross section. But this is the fibularis longus right here on the lateral side of the foot. And this is the fibularis brevis, short muscle. Fibularis longus, fibularis brevis. Okay. Superficial posterior compartment. The gastrocnemius, which you saw in the last video, the soleus, and the plantaris. Okay. Looking at the cross section, this is the soleus. This is the gastrocnemius. Comes along the side. Okay. Anterior compartment. Anterior compartment is the iliopsis, the quadriceps femoris, the sartorius, the extensor digitum longus, extensor hallucis longus, the fibularis tertius, and the tibialis anterior. You can see the difference between the cross sections. There's a sartorius again in the anterior section of this. Here's your anterior section right here. Okay, that's your anterior component. Okay. Medial compartment. Medial compartment contains your adductor longus, your adductor brevis, pectineus, the adductor magnus, gracilis, and obturator externus. Okay, that's in the medial compartment. So here's your medial compartment here, broken out. You can see the adductor longus and the adductor magnus. Magnus is the bigger muscle, the larger. Deep posterior compartment. Okay, the popliteus behind the kneecap, the flexor hallucis longus, the flexor digitorum longus, and the tibialis posterior. Okay, you know the popliteus runs behind the kneecap. You know the flexor hallucis longus flexes the hallux, the big toe. The flexor digitorum longus flexes the digits, the phalanges of the foot. Okay. Again, cross-section is very difficult to identify, but you see the flexor hallucis longus coming down in the deep posterior section. Okay. In the posterior component of the thigh, you have your hamstrings. Okay. Hamstrings are composed of those four muscles we talked about.